Before medical school, you were the smart one. In your family, in your school, in your community. You were the one everyone pointed to and said, that one is going to be a doctor. You carried that identity proudly. It became who you are. And then you walked into medical school. And for the first time in your life, you were not the smartest person in the room. Welcome back to Mindset in Medicine. This is episode 2 of our 10-part series exploring how mindset shapes every corner of your life as a healthcare worker. If you missed episode 1, go back and watch it first. The foundation we built there is important for everything that follows in this series. And if you are new here, welcome to the Medical Hub. Subscribe right now and turn on notifications so you do not miss a single episode. Today we are going somewhere that nobody talks about openly. We are talking about what medical school does to your mindset. Not intentionally, not maliciously, but systematically. Because the medical training system, as brilliant as it is, has a hidden flaw. It rewards appearing smart over actually learning, and that difference is everything. Let me explain what I mean. Medical school is built on assessment, written exams, OSCEs, viva voce, practicals. From day one, you are being measured, ranked, scored, compared. Now that system has a purpose. We need to ensure that only competent clinicians graduate. Lives depend on it. But here is the unintended consequence. When your entire self-worth is tied to your exam score, you stop learning to understand. You start learning to pass. And those are two very different things. A student with a fixed mindset in medical school does something very specific. They avoid anything that might make them look stupid. They do not ask questions in tutorials, because what if the question sounds too basic? They do not attempt difficult clinical skills in front of others, because what if they fail publicly? They choose the easiest topics for presentations, because what if they stumble? Slowly, quietly, they build a smaller and smaller box to live in. A box where they feel safe and competent, and they call that box their specialty. If this is already hitting close to home, go ahead and like this video. It helps this series reach more healthcare workers who need this conversation. Now contrast that with a growth mindset student. They ask the question, even if it sounds basic, because they understand that a question asked is a gap closed. They attempt the procedure, even badly the first time, because they know the first attempt is always imperfect. They choose the difficult topic for the presentation, because they know the discomfort of preparation will pay off. That student leaves medical school not just with a degree, they leave with a learning machine inside them, one that keeps working long after graduation. Now let me be very honest with you about something personal. I have been in both places. There were moments in my own training where I performed confidence I did not feel, where I nodded along an award round rather than admitting I was lost, where I gave an answer that sounded right rather than saying those 4 honest words, I do not know, because the culture said, a good doctor knows. That culture is dangerous, not because it expects excellence, but because it punishes honesty. And in medicine, a doctor who cannot say, I do not know, is a dangerous doctor. There is a pattern that shows up in medical training all over the world, the pretense of competence, performing certainty you do not have. And it looks the same whether you are in a teaching hospital in Nairobi, London, Lagos, or New York. It looks like this. The intern who bluffs through a case presentation because admitting confusion feels like failure. The resident who copies their senior's management plan without understanding why. The student who memorizes without truly comprehending. Now, I am not blaming individuals here. The system creates this. When you were penalized every time you got something wrong, you learned to hide your wrong answers. When teachers dismissed students who asked basic questions, everyone stopped asking. When rankings were posted publicly, your identity became your position on that list. The system trained the fixed mindset into you. And that is important to recognize, because you cannot change something you do not see. Pause here for a moment, comment below. Tell me, did your medical or nursing training make you feel safe to say, "I do not know"? Or did it teach you to perform certainty even when you had none? I read every single comment, and your answer matters. So how do you break free from this? The first step is redefining what it means to be a good medical student or a good doctor. A good doctor is not someone who never gets things wrong. A good doctor is someone who catches their errors early, learns from them, and adjusts. A good medical student is not someone who knows everything. A good medical student is someone who knows what they do not know and goes to find out. That reframe alone changes everything. There is a concept in learning science called desirable difficulty. It means that learning which feels hard in the moment actually sticks better. When you struggle through a problem before being given the answer, you retain it longer. When you attempt a procedure badly before it is corrected, you embed the correction more deeply. When you sit with confusion before finding clarity, the clarity becomes permanent. The discomfort is the learning. The medical students and doctors who understand this embrace the difficult cases. They request the challenging rotations. They volunteer for the procedures they are least comfortable with, not because they are brave, but because they understand how growth actually works. Medical and nursing students, I want to speak directly to you for a moment. You are in the most intense period of your professional life. The pressure is immense. The stakes feel enormous. And the temptation to stay within what you already know is very real. But hear this clearly. The patients you will serve in 20 years will benefit or suffer from the habits you form right now. If you learn now to hide your gaps, you will hide them later when the consequences are life and death. If you learn now to say, "I do not know, let me find out," you will do that later when it saves lives. Your mindset right now is writing the doctor you will become. Here is your practical step for this week. In your next tutorial, ward round, or clinical encounter, ask at least one question you are actually afraid to ask. Not a question you already know the answer to. A real question. A genuine gap you have. Notice how it feels. Notice how the world does not end. Notice that the clinician you ask probably respects you more, not less. That small act is a growth mindset muscle being built. And like any muscle, the more you use it, the stronger it gets. If this series is speaking to you, please share it with a medical student or intern in your life. Not with a caption, just send them the link. That one share could change how they practice medicine for the rest of their career. And subscribe if you have not yet, because episode 3 is coming, and it is one that every qualified healthcare worker needs to hear. We are talking about what happens when a doctor stops learning, and how you make sure that doctor is never you. We are the Medical Hub. This is Mindset in Medicine, and we will see you in episode 3.